So welcome to the ASM webinar, The Science of Success, Building a Career in Lab Operations. This webinar is brought to you by ASM's Clinical Microbiology Mentoring Subcommittee. Please visit the ASM website to browse resources provided by the subcommittee or to get in touch with a mentor. Thank you for joining us today. My name is Zenda Barata, and I am the Chief of the Microbial Diseases Laboratory Branch at the California Department of Public Health. I will be introducing today's speakers and the panelists. We will start with our speakers, James Lapan and Don Monzel, and then I will introduce the panel after the presentations. So Jim Lapan is the Director of Laboratory Services, Microbiology at the Northern California Kaiser Permanente Regional Laboratory. He brings over 30 years of clinical microbiology experience in reference laboratory settings, including roles at Quest Diagnostics, LabCorp, and Kaiser Permanente. Throughout his career, Jim has embraced numerous learning opportunities that have equipped him with the knowledge and expertise to thrive as a leader in clinical microbiology. Our second speaker is Don Monzel. Don is the Director of Outreach Operations at Wisconsin Diagnostic Laboratories in Milwaukee, Wisconsin. A medical laboratory scientist by background, Don has over 35 years of laboratory experience in both technical and business operations, with current oversight for business development, customer service, reference testing, and outreach phlebotomy. Dawn is passionate about applying her knowledge and experience gained through many roles over the years to bring the best academic laboratory medicine to the Froedtert Theta Care Health Enterprise, as well as the many clients that WDL serves in Southwest Wisconsin. So thank you for joining us again, and I will now turn the mic over to Jim. Jim?
Thank you, Zenda. Can everybody see my presentation okay?
Yes, we can see it.
All right, great. Well, welcome everyone, and thank you for joining today's webinar. Today, I'd like to discuss laboratory operations within a clinical laboratory setting and share my career journey, which has been primarily centered on microbiology in reference laboratories. Here are several key elements that are essential to effective laboratory operations. We have daily workflow, equipment maintenance, supply management, personnel staffing and scheduling, quality control and quality assurance, safety and compliance, regulatory compliance, and data handling. So why are laboratory operations important? Well, providers depend on accurate and timely laboratory test results to assist with patient diagnosis, treatment, and to monitor patient progress. It's important to provide a safe work environment to protect employees and to handle laboratory waste appropriately to protect the environment. We are required to meet regulatory standards such as CLIA, CAP, and OSHA standards. We want to minimize any errors and delays in testing, and it's important to minimize waste and manage our spending appropriately to ensure the financial health of our organizations. There are many important roles in a clinical laboratory, including technical roles such as lab assistants, phlebotomists, medical lab technicians, and clinical laboratory scientists. There's quality and compliance roles, QA/QC specialists, lab information specialists, and administrative and leadership roles such as supervisors, managers, directors, and medical directors. My journey and interest in science began in high school in biology, where I found myself genuinely excited and eager to learn more. I went on to attend Sacramento State University, initially majoring in biology. At the time, I wasn't entirely sure what career path I wanted to pursue, and without the convenience of today's internet resources, researching science-related fields and job opportunities wasn't as straightforward. Eventually, I did discover clinical lab science, which aligned perfectly with my love of science and hands-on laboratory work. I changed my major to clinical laboratory science and later completed my medical technology training through the San Francisco State University program. My clinical internship took place at SmithKline Beecham Clinical Laboratories, which was a high-volume reference laboratory, which later was acquired by Quest Diagnostics. Once I passed the board exam, I did start as a medical technologist at SmithKline Beecham Clinical Laboratories. I started in hematology on the night shift, performing miscellaneous hematology tests such as coagulation, sed rates, reticulocyte counts, body fluid analysis, and semen analysis. But my love really has always been in microbiology. And so when the first opportunity came with an opening in micro, I did transfer there where we performed basic bacteriology cultures and parasitology. So in this first 5 years of my early career, it really was just acquiring the basic skills as a bench tech, which I really loved. One of my first career opportunities for growth came out of a quality incident within the organization that highlighted the need for more quality oversight. A quality assurance specialist position was created to inspect and assess the overall quality of the region's phlebotomy draw stations and stat laboratories to ensure procedure manuals, instrument maintenance, and quality control records met company and regulatory standards. I was awarded the position and spent about a year visiting our organization's specimen collection sites and stat laboratories. During my inspections, I did encounter several quality and compliance issues that needed to be addressed and corrected. This experience gave me a much deeper understanding and appreciation for regulatory compliance, standardization, and quality improvement. It's proven to be invaluable and has supported me in numerous situations throughout my career. After about a year in the quality assurance role, I realized I really missed my love of microbiology and I returned to the micro department as a lead CLS. In addition to the bench work I previously performed, my new responsibilities included staff scheduling, employee training, reviewing QC and QA records, as well as preventive maintenance records, and some basic instrument troubleshooting. I was eventually promoted to CLS supervisor with additional responsibilities of employee performance evaluations, investigating errors, nonconformities, and test discrepancies, and overseeing our proficiency testing program to ensure the accuracy and reliability of our test results. In 2003, Quest Diagnostics acquired Unilab. Part of that transaction was to divest certain assets to LabCorp, which I was part of. This was a very anxious, challenging, yet rewarding experience. We transformed a small stat lab into a full-size reference laboratory that had no microbiology department at the time. With the help of a sister LabCorp laboratory, I helped establish procedures, perform testing validations, and ensured all the work met our quality expectations, as well as meeting CAP, CLIA, and state regulations. This was a very satisfying and rewarding accomplishment, which would lead to another future opportunity in my career. I was later promoted to lab manager, which expanded my scope of oversight to the hematology and specimen processing sections of the lab, in addition to microbiology. My next opportunity came about through what I can only describe as fate. It's amazing how many people we meet and know within the clinical laboratory community. It's important to network with other laboratorians and stay connected. Learning from peers in different labs is valuable, and you never know when a great opportunity might rise. After a few years at LabCorp, I was looking for a change and had applied for a manager position at microbiology at the Kaiser Permanente Regional Laboratory. Sadly, I was not getting a call back. About a month later, while preparing for an upcoming CAP inspection to be conducted by Kaiser Permanente, I noticed that the inspector for the micro section was the micro lab director at the regional lab. My mind raced, realizing this director was likely the hiring manager for the position I had applied to. My goal was really just to successfully get through the inspection, and I would follow up on that job opportunity afterward. Well, the inspection went extremely well, and I must have made a good impression. About a week later, I received a call from that inspector, and he said he recognized my name and had my resume on his desk. He asked if I was still interested in the position, and the rest, as they say, is history. So I joined Kaiser Permanente, Northern California Regional Lab, as the section manager of bacteriology. This role involved overseeing a much larger laboratory in terms of test volume and staffing within a unionized environment, which was new to me. It was a significant change and challenge, but with tremendous support from my new colleagues, I fully embraced my expanded responsibilities. As the manager of the BACT section, my main responsibilities involved oversight of the day-to-day operational workflow and staffing in the BACT section, operationalizing testing, procedural, and instrumentation changes, working on special projects such as coordinating a new LIS system implementation and ensuring CAP inspection readiness within the department. My responsibilities eventually expanded to include oversight of the immunodiagnostics and molecular diagnostics sections within microbiology. In 2015, I was promoted to my current role of Director of Laboratory Services Microbiology. As director, my responsibilities broadened to overseeing a management team and more than 300 staff members. I was accountable for overall team performance, assessing, planning, and implementing new assays and instrumentation, ensuring we met budget expectations, and coordinating with medical center laboratories on new and evolving microbiology strategies. Kaiser's quite different from the reference laboratories I previously worked in because it operates as an integrated system. Our network includes medical centers with local laboratories, medical offices, and physicians, all interconnected through a unified laboratory information system and electronic medical record system. This integration enables us to collaborate effectively and develop the best testing strategies for our patients and members. In microbiology, we work closely with our infectious disease provider group to ensure we meet the needs of our clinicians. Laboratory operations were really put to the test during the height of the COVID pandemic. All of us that were in the lab during this time can attest to the challenges that we were faced with on how to get COVID testing completed when test volumes were going through the roof. Thinking back on this, all aspects of lab operations were used to successfully get us through this. As test volumes started to increase, we were coming to the realization of what this was becoming and had to prepare for the worst. At the Northern California Kaiser facility, we were fortunate enough to have a large warehouse that we were able to convert to a testing lab. I was asked to draft a lab design given a huge amount of space that would accommodate all of our testing needs. Not knowing exactly what to expect, we tried to plan for everything. We designed a receiving area for specimens to be received, processed, and stored, multiple testing areas to accommodate pre-analytic specimen handling, and various instruments to perform the testing and storage, as well as admin areas to support the new COVID lab. Early on, we didn't know what the supply availability was going to be, so we tried to get our hands on all the main vendor instruments and assays we could, all of which had to be validated and interfaced with our LIS. We had to register to perform these tests, including CAP proficiency testing. Staffing was incredibly important and was a huge challenge as test volumes started to rise. Our changes and adjustments came in waves as test volumes rose and got increasingly harder to complete in a timely manner. When we initially hit 1,000 specimens a day, that was when we had to create the new COVID lab. At 3,000, we had to make adjustments to staffing at workflow. At 6,000, you're thinking we're never going to get to 10,000. This isn't possible. Yet test volumes continued to climb. The tweaks to workflow, staffing adjustments, and moving testing around to the various platforms was a constant juggling act to find the right balance to meet the demands of testing. In the moment, you don't think of the stress that's happening. You certainly feel it, but as laboratorians, we push on and find a way to get it done. We eventually peaked at over 20,000 specimens in a 24-hour period. Looking back on this time, I'm extremely proud of our entire team and what we accomplished. I hope we don't ever have to do anything like this again in my lifetime, but if we do, I know we have the knowledge and experience to get through it. So what has helped me succeed on my career path? Well, it helps if you have a passion and truly enjoy what you do. Without joy in your daily work, it's really difficult to have the drive to succeed. Working in a clinical lab can be very stressful and challenging. You'll often need to juggle multiple priorities and will deal with stress in many forms, heavy workload and turnaround time demands, challenging colleagues, anxious and demanding physicians, instrument issues, reagent back orders, and many more hurdles to overcome. If you can maintain a positive attitude, have a strong work ethic, and have the resilience to overcome challenges, you will have a great chance at success. When opportunities to learn or advance come your way, seize them. Every chance to expand your knowledge and experience will not only make your current job easier, but will also prepare you for future growth and advancement. In closing, there are many aspects of laboratory operations that you can pursue as a career. The key is to find what interests you and embrace any opportunities to learn and expand your knowledge. I've had a very exciting and rewarding career up to this point, and I wish you the best on your journey in the laboratory field. Thank you very much for allowing me the opportunity to share my experience with you today.
Fantastic. Thank you so much, Jim. So now we'll go on to listen to Dawn's presentation. Dawn?
All right. Well, good afternoon, everyone. It's a pleasure to be with you today. When I was asked to participate in this, it was an opportunity for me really to think about my career in the laboratory. And personally, it's not something that I've thought a lot about, as I've gone through 35 plus years of laboratory experience. It was quite a joy to look back at, what has gotten me here and where I'm going in the future. So when I think about laboratory operations, we talk about what does that really mean, right? And really it is lab operations focuses on all of the day-to-day things that happen in the laboratory that really funnel towards that organization's goals for efficiency, financial outcomes. But to me, it really comes down to two basic things that I think really create that structure of lab operations. And it's clinical, right? And it's business and financial. And when everyone has heard the data that 70 to 80%, and I think it may be even more than that, medical decisions are based on laboratory data. And so the laboratory's role within the larger healthcare organization is paramount. And Jim talked about it, and I'm glad that he did. His experiences with COVID, and at Wisconsin Diagnostic Labs, ours were very much the same. We were struggling with capacity. We were struggling with supply chain. We were very fortunate to have testing happening on 5 different COVID platforms at one time. And COVID really opened the door for us, and I think many laboratories, to really secure your place within the larger healthcare system. We had our healthcare system looking to us for designing processes. A great example, I recall I was off on Christmas Eve day and I was doing some last minute shopping. I got a call from my medical director and he said, "Can you get an employee testing station set up yet today?" And that was Christmas Eve, and I did, right? And so when we talk lab operations, those are the kinds of things that we get involved in. And we set that up on Christmas Eve, and we provided a great service not only to our own healthcare system, but largely served most other healthcare systems in southeastern Wisconsin and northern Illinois. So I think COVID has opened that door, and I think most labs, and it sounds like Jim has too, really seized that opportunity to be that leader within the healthcare organization. As laboratorians, we're the experts. There's no one better to talk about laboratory testing than laboratorians. And really, our clinical mission here is the right test at the right time, the first time, and every time. And so, when we talk about lab operations, it's ever changing, new technologies leading to faster diagnosis, treatment plans, precision medicine. That's what the laboratory brings clinically to the healthcare organization. And on a business and financial mission, we're helping to be good stewards of healthcare dollars, right? We don't get paid more when we do more testing. We want to do the right testing. And also for many laboratories, and this was our story many, many years ago, there's an opportunity to grow your outreach business to help sustain and drive revenue for your own laboratory. So when I think about what are the things that are really important or the traits that someone should have if they're looking for a career in laboratory operations. And the first one that comes to mind is being agile and aware of situations, right? So know what is going on in your department and your laboratory. Agile leaders are adept at identifying risks and roadblocks to processes, but also really important that you can flex your leadership style and adapt to whatever situation is going on to meet those goals. Another key trait that's really important, and personally for me has been something that I continuously work on, is patience. As operational leaders, we're expert problem solvers, right? We're agile solution seekers. We're really good at finding solutions to things, but these things take time, right? And I think, you know, different laboratories that I talk with, and we say, you know, what are the roadblocks for you? And really, you know, IT always comes up, and nothing against our IT friends, right? But the lab is so highly IT driven, right? Um, you know, IT security is paramount, legal, you know, contracting, things like that. So it does require a lot of patience, you know, playing the long game, right, to get where you want to go. Another important trait is integrity. And, you know, I can't overemphasize this one enough. When you're an operational leader, you have a responsibility to get a lot of different people, you know, on board with the changes that you are proposing. And we'll talk a little bit more about that. And in operations, things change, and they change frequently. And change is difficult for people. And so you having a lot of integrity, building relationships, honesty, you know, and knowing that you've mindfully approached the changes, you know, helps you to build those relationships. And it absolutely makes, you know, executing your operational goals a whole lot easier. And finally, foresight, you know your organization, know your market, right? Um, One of my best suggestions, if you're looking for a career in operations, is really understand the processes end to end, right? So who orders from us? How do specimens get here? How do they get to the testing sections, and what happens after that? It's not that you need to be an expert in all of that, but having an understanding of that end to end process really helps you to identify, you know, what risks you might have, what roadblocks you might run into. And also really important that when you're looking at any operational process, to identify your stakeholders early on. You know, who needs to know about this and who is impacted? And so, you know, I've made that mistake, right, of not thinking through that clearly. And so getting the right people around the table to talk about operational changes helps you to be able to bring that change forward in a much easier manner. So talk a little bit about my own personal career journey. And, you know, I would love to say that, you know, this was all like I knew what I was going to do over the course of these 35 years, but I would also be remiss if I didn't say I've been given some really great opportunities for growth that I wasn't expecting. And I think that's, you know, being open to that. And, you know, as Jim said, and seizing those opportunities, getting out of your comfort zone a little bit, really, you know, has helped me grow and understand, you know, how I've gotten here. So I did start my career in the laboratory as a phlebotomist when I was in college at the University of Wisconsin, Oshkosh, in the medical technology program. I had never had my blood drawn in my life prior to picking up a needle to draw someone else. And so that was an interesting experience for me. Spent a few years as a phlebotomist, and they also paid for my last 2 years of school, provided I would work for them for a number of years after that. So I got experience in hospital and outreach phlebotomy. I drew in nursing homes and in the ER. I also was a hematology assistant. I made slides. I even one summer was a cytology assistant when we used to put cover slips on pap smears. And so I learned all kinds of things in the laboratory. Once I graduated, I became a technologist. I was a generalist on the PM shift. Unlike many of you, I am a generalist microbiologist, but have actually never really worked in a microbiology laboratory as part of my career. It is really the one area of the lab that I have not had experience in since I was in training. But as a PM shift generalist, you know, I did hematology, chemistry, blood bank, and even got the opportunity to perform some veterinary work. The organization I worked for at that time had a vet outreach business, in which you can imagine living in Wisconsin, farm animals are really important to us. And so we did veterinary testing on cows, horses, dogs, and cats. Um, and for those of you who are dog lovers out there, I don't think it's any coincidence that the laboratory chemistry and hematology profiles most closely match humans. I always found that to be very interesting. As part of that role, I also, much like Jim, again, did some work as a quality specialist, really looking at patient safety events, safety trends, and recommendations. So it was very early on in my career. So it really gave me an opportunity to really build some root cause analysis skills and look at processes within the laboratory. From then, I transitioned to a different organization, the one I'm currently at now, as MLS, and then became a technical specialist. And this was, this was what I thought my career was going to be, right? I became a key operator on all the key instrumentation in the laboratory, went off to school, trained on that, brought those skills back, and was responsibility for the training and competency assessment of all the technologists on the shift. I'm going to date myself a little bit and say I couldn't program a VCR, but I could work on, $250,000 instrument and fix it and troubleshoot it, and really, really enjoyed that part of my early career experience. Kind of mid-career was really when I made the transition from technical to operational. And looking back, I really didn't see it coming, but I was promoted to core lab supervisor for second shift, gave up some of those technical responsibilities as key operator, and really became responsible for the operations. At the same time, we shifted focus from being just a hospital laboratory to being a hybrid reference lab, to which we are to this day. So we are physically located on the campus of Froedtert and the Medical College of Wisconsin. We have a quaternary hospital here on the campus, but we are also an outreach laboratory. And so we serve our health network, but also non-affiliated clients who choose to do business with us. And so we entered that outreach market. And the first thing I was charged with was designing a specimen receiving department to take in about 5,000 samples per day. Had no idea what I was doing, but found quite quickly that I had a knack for process and workflows. And so happy to report that many of those same things that I developed about 28 years ago still exist today, different LIS system and things like that. But many of those core functions of a specimen receiving department are still there. Throughout this part of my career, we also moved an entire laboratory to a new building, converted our lab information system to a new platform twice now, and really was responsible for monitoring those production schedules on the PM shift, because we had a goal of everything being reported by 5 a.m. in the morning. So we were taking advantage of the downtime in the hospital to use that to do all of our reference work for our outside clients. After that, moved more into the manager of client services and reference testing role. So I wanted to get off of the PM shift for family reasons, and an opportunity became available in client services. And with all my work with outreach already on the specimen receiving side, it became just a really natural fit for me. I'm very passionate about customer service, and I'm really proud of our client services and reference teams. So currently, the team is about 20 client services representatives in our call center. We have some leadership in there, so I don't have as much hands-on work with them as I did in the past. But we provide all the lab support for the hospital, the health system, and over 400 clients located in southeastern Wisconsin, northern Illinois. We are the hub of communication and all problem resolution. and really take pride in ourselves in providing that. Our goal is to keep phone calls and problems away from our testing areas in the laboratory and allow them to do the great work that they do. In our reference lab, we obviously are sending specimens out to other institutions that we do not perform that testing here. And that is about a $10 million spend per year. And so we have some initiatives around maintaining that reference testing and also stewardship and utilization of reference testing. So in my current role, I am the Director of Outreach Operations, which is a new role that was created several years ago. So I do have oversight over that client services team, which is about 22 people right now. Business development, so this is our account management and support team that works out with our outreach clients. We do have 4 folks that work in that area, so maintaining client satisfaction, growth, and IT integration. Reference testing, again, focusing on stewardship, right test, right time. We've seen an enormous amount of growth in molecular oncology and recently have developed a lot of processes around managing that. And then outreach phlebotomy. We have a team of about 55 phlebotomists and 4 leaders. And we are out, every day in long-term care, home care, in-office phlebotomy, and patient service centers throughout the Wisconsin area. So when I think about my role as an operational leader in our laboratory, think about the lab in 3 ways, right? We have pre-analytical processes, analytical processes, and then post-analytical. And operations really in our lab bookends the analytical testing, right? So our pre-analytical focus is on things like customer and account management, phlebotomy, IT integration, specimen transport, logistics, specimen receiving, right? Post-analytical, we have results reporting, billing, finance, quality overarches over all of that. So it takes a lot of us to manage all of these different things that we call laboratory operations. And so we talk about who does lab operations work with, right? I think we talked a little bit earlier about, that need to pull all of those groups together. And this is just a sampling of, the different groups that lab operations will work with. Clinical care teams, physicians, service lines like oncology or transplant, but also our pathology medical directors, right? Our key part of that. Quality, compliance, risk management, and legal, finance, revenue cycle, right? We want to make sure we're getting paid for the work we do. Our lab technical departments, IT obviously is a huge component of that, and customer service and our business development team. So how do we get things done? It's a great question. So a couple of ways that we get things done here is through participation in accountable care teams. I'm sure many of you are familiar with that, but if you're not, it is a multidisciplinary team that takes responsibility for improving the care, clinical outcomes for a defined group of patients. And our lab leaders participate in 22 accountable care teams across all of our service lines. For me, my accountable care team is the surgical trauma ICU. I've been involved with that group for probably about 15 to 20 years already. So it's kind of a passion project for me. But what it allows is them to have a direct connection to someone in the laboratory. And sometimes they throw questions at me that I don't know the answers to. But it allows me to take that opportunity to learn what's important to them. And also bring things from the laboratory back to them in a way that we've built a really strong relationship. One of the other ways that we get things done through lab operations is through what we call our lab stewardship committee. And this really, again, got traction after COVID when the health system recognized the value that laboratory could bring to the table. So the Lab Stewardship Committee is comprised of both clinical and laboratory medical director co-chairs, participation from lab section directors, depending upon what the focus is, and then lab operations. The members can kind of come and go a little bit based upon what the focus is. But really, there are 2 goals of the Lab Stewardship team. And one is a clinical goal to be prospective rather than retrospective. And what I mean by that is, can we design things that help clinicians to order the correct test up front rather than them ordering something, having it come down to lab and say, we're not sure that you want that, this might be a better idea, right? So we've taken some steps around that, as well as financial, and being good stewards of healthcare dollars. We want to make sure that lab is also getting recognition for those financial savings. So this is just, I'm not going to go through this by any means, but this is just a listing of some of the stewardship activities that we've had from 2024. There are a few microbiology related ones on here. I'm happy to answer any questions about those later on. So how do we get alignment? We've got all of these groups, working. They're subject matter experts in their own fields. And how do we get everybody to work together? And it is a challenge. And as an operational leader, it's your job to translate. Many of the requests are very IT heavy, right? I think we all know that. And, in our own institution, we've got lots of silos within the IT department, right? Clinical, technical, we've got IT analysts, we've got analytics folks. And so as an operational leader, really bringing all of that together. And one of the things I wanted to share with you is an approach that I think works pretty well when you're trying to get everybody on board, or you have an idea for an operational change. And it's to really approach it as, here's what's not working for me or us, right? And here's what we want to try and achieve. And let these experts come up with a solution, right? Rather than me saying, here's what I think we need to do. And I've had a lot of success with this because all of these folks are experts in their own field. They're coming at it from, they have a place that they're coming from with what they want to share. Tell them what the problem is and, let them kind of come up with the solutions. And I think that's a really valuable place to start. So how do we get, how do we translate lab operations for a non-lab audience, right? In our field, we work with a lot of non-laboratorians or even non-clinical folks. And one of the things I always, try to emphasize is that for non-laboratorians, someone may be a medical assistant, an RN, laboratory operations is a very, very small part of their job every day, but it has a huge impact on what we do internally. And so keeping that in mind, that their knowledge of laboratory is limited and because it's just a very small part of their day. Knowing what's important to your client, right? What's different, it's important to a medical director versus an MA at a client office. Explain your why. This is your opportunity to educate, right? Why do we do things in a certain way? Why do we require certain things, right? And this is a great opportunity to share your laboratory knowledge. And finally, to keep it simple. And I love this quote from Steve Jobs: simple can be harder than complex. You have to work hard to get your thinking clean and make it simple. And that is absolutely true in lab operations, because it is really easy to spin up a complicated process, but it is hard to make a simple one. And as I reflect on my career, I happened to come across this and I said, I haven't thought about a career. I've been focused on my journey. And I really love this because at the beginning of my career, I'm a technologist. I'll always be a technologist. I had no idea that this was where this was going to take me, or even that I had these untapped skills that would lead me to where I'm at. So thank you very much. I appreciate the time to talk with you today and share a little bit about my journey.
Fantastic. Thanks so much, Dawn. And I'm with you with the VHS programming. So thanks, Jim and Dawn, for your very informative presentations and overview of your career paths and how your roles in lab operations support the laboratory. And we all enter this field because we love science and we want to help people. And it's just really great to learn more about careers in laboratory that are really important in helping the lab run smoothly and that still utilize all of that technical knowledge and experience. So thank you very much. So now we will move forward into the panel discussion. And as a reminder, text chat is located on the right-hand side of your screen. And to submit a question, type your question in the small text box at the bottom. So today we are joined by Dr. Utsav Pandey, the Technical Director of Microbiology Services at Kaiser Permanente and a Clinical Assistant Professor at the Kaiser Permanente Bernard J. Tyson School of Medicine, and Dr. Thuy, the Associate Director of Infectious Disease Testing at Montefiore Medical Center and an Assistant Professor at Albert Einstein School of Medicine. So let's start by learning a little bit more about Dr. Pandey and Dr. Thuy's experience and career background. Dr. Pandey, we will start with you.
Thank you, Dr. Barada, for the introduction, and thank you to ASM's Clinical Microbiology Mentoring Subcommittee for inviting me to be a part of today's panel on lab operations. It's really great to be here. My career in the clinical lab started as an undergraduate intern in a clinical lab science program. After that internship, I got a job as a clinical lab scientist in microbiology, and honestly, I wasn't sure where I was going to go with it. But while I was working at the bench, I learned about the role of PhD lab directors, and I had always wanted to go back to pursue further education, but wasn't sure for what. So my experience as a bench scientist gave me the direction I needed. So after about 3 years in the lab, I decided to start graduate school, always keeping in mind that I wanted to come back to the clinical lab in some kind of leadership role. After finishing my PhD, I went on to do a CPEP Clinical Microbiology Fellowship at the Children's Hospital Los Angeles. My first job after fellowship was as a microbiology lab director at Westchester Medical Center in New York. It was a great experience, but after 14 months on the East Coast of the United States, for personal and for professional reasons, I decided it was time to come back to California to take on my current role as the technical director of microbiology at Kaiser Permanente, Southern California. Although my title here is that of technical director, my role extends beyond just technical oversight. I work in close partnership with the lab operations team to provide strategic leadership and guide the broader direction of our department. We are a centralized lab supporting 17 medical centers across the Southern California region. So our success depends heavily on strong and efficient operations. Over the years, I've come to deeply appreciate the critical importance of lab operations. While clinical and technical expertise are essential to lab medicine, I truly believe it is the operational infrastructure that ensures the consistent delivery of timely, accurate, and high-quality results. In many ways, lab operations forms the backbone of a successful clinical laboratory. That's all for me for now, and I'm really looking forward to the discussion and to your questions. Thank you.
Great, thank you so much. Dr. Thuy?
Thank you, Dr. Barada, for the introduction. And I'm excited to be on this panel and well, welcome everyone for joining in this webinar. And first of all, I have to do a shameless plug for advertising our clinical microbiology and mentoring subcommittee. So I'm a member of CMMS subcommittee, just as Dr. Barada is. So I'm excited to be here discussing our career pathways and especially focusing on the lab operations. So I share my career path has there's some similarity to some of the folks on here on this panel and the speaker. I was told by many people that, oh, you are a microbiologist by training. So yes, I am. I did my undergraduate in MLS, medical lab science, and in Wisconsin, Milwaukee. and so my love for and my passion in microbiology, it grew when I was in my senior year, working on a clinical microbiology project, and that's how, just like Dr. Pandey was mentioning, and like I know, I wanna do some work in the microbiology lab. I also wanna advance my career because my mentor, she is a PhD microbiologist and educator apparently. So I want to do something in clinical microbiology. So I got board certified, ASCP board certified, and after that, I lucky or unlucky for me, I only set my foot in the core lab only during my clinical rotation. And so right out of college, I got a job in a clinical microbiology lab as a medical technologist. So I spent a couple of years working as a bench technologist, and that's how my passion for clinical microbiology even grew stronger. And I want to be, to go up into the career ladder, and I want to be in the I see that laboratory director, microbial lab director, or even CLIA lab directors, how they are performing in the leadership role. And I really want to step into this role, but I need to get my advanced degree, and so I went on to do my PhD in immunology, and obviously, a little bit touching on the infectious disease, and I found my way back into the clinical microbiology after my PhD training. So I did a clinical microbiology and public health fellowship, CPAP fellowship at University of Texas Medical Branch Galveston. So actually, Dr. Pandey and we graduated in the fellowship program, the same batch. So happy to be, honored to be on the same batch with you. So right, pretty much throughout my career, I had a privilege of working with a number of, technical directors, right, microbiology or CLIA lab directors who really, have really a subject matter expertise in their areas. And they set up example in working together with lab operation leaders like Dr. LePen and John. And this is not a small role, as Don mentioned, lab operation is a small part of the laboratory, the entire department of laboratory. However, they really touch on multiple areas. So we even though I'm a specialized in microbiology, we really pretty much we rely on lab operations. And when I step foot into the microbiology lab as lab directors, as a lab director, I was like, wow, this is a huge role, right? And how am I gonna do all the work? Yes, I do have subject matter expertise, but I couldn't I couldn't acknowledge without acknowledging our counterparts, our partners in the lab operation role. So to be honest, so I've also had a privilege of working with, pretty much throughout my career, amazing lab supervisors, lab managers, and Dr. LePen highlighted his career pathway and as a supervisor manager. You also done a lot of lab operation role, even as in each step of the way. So I've had a privilege of working with all those the lab supervisor manager, even in the microbiology lab or in the lab operation or in the core lab. So really though, working together with all of them, sharing their success stories. And so I really looking forward to a great discussion panel and answering any questions that you may have.
Hey, thank you, Pugh. Okay, so I have a few questions just to start, and then as a reminder, you can put your questions in the Q&A or the chat, and we will we'll try to answer those that we can. Okay, and this may have been mentioned in a couple of the presentations, but what is one skill that you think is critical for someone that is interested in a general operations career? Dawn?
Sure, thank you. I think one of the best skills you can have is solid problem solving and decision making skills. Knowing, looking at your problem clearly, like getting those stakeholders involved, right? Really investigating that. But one of the things that I think as laboratorians, we have a focus on perfection and excellence, right? And we should, right? What we do is incredibly important. But it's also really important to remember that when you're looking at changes or improvements, it's a process, right? And don't let perfection be the enemy of good, right? What matters is progress towards the right goal, right? You may not be able to get there right away, but that shouldn't stop you from moving forward.
Great advice. Anyone else?
I'll just add, I think it's important to be willing to be part of a team and work as a team, because teamwork is absolutely essential in the laboratories. So, that's one skill I think is extremely important. You have to be able to get along with people and work as a team.
Also, when someone was really, I came off really, as a person who was really shy, and really when you have questions about your career growth, or there are people around you who are really willing to help around, so don't be intimidated by their roles or what they are doing. Or sometimes, like, oh, you see, like, hey, this, like, this supervisor or this manager, they're wearing so many hats, and I'm so afraid to the to be to talk to them. Or don't be intimidated by that, their roles or their multiple hats that they're wearing. So questions, and be open to ask questions, or seek advice. That's one advice that I would give.
Okay. And I would just add, kind of on the same vein, is communication. Just being able to work in across different areas. Definitely, kind of playing on the teamwork component, but being able to communicate really well, and work with other teams that may not be necessarily part of your laboratory team. So for instance, IT. We go into science and we don't think we have to know very much about laboratory information management systems, and it's amazing, how much you learn that that's not the case when you're in the lab. So, so thank you for your insights. Maybe one more question, and I am seeing a couple of questions in the chat. How do lab operations integrate with other units in your institution? So maybe a couple of folks can comment on that, and then we can move over to our chat questions.
Well, at Kaiser, we do have local medical centers. In microbiology, we perform, the bulk of testing for microbiology, but the local medical centers do some of that testing. So we do work together on both pre-analytic as well as analytical, more urgent testing that's performed at the medical centers. We support them in making those decisions. We have a microbiology peer group where we get together, quarterly to discuss microbiology related topics and how to best approach micro testing.
Yeah, I would second what Jim says. Our organization has what we call collaboratives. So we have a chemistry collaborative, micro collaborative. We're really trying to align operations across the enterprise. And so that has been very successful. And also I talked a little bit about like our lab stewardship team. And I think, that's where we've really seen, I think, the most progress forward is, getting our medical directors and clinical partners aligned on initiatives. So it's not just something coming from the lab, but we've seen a lot of focus at our institution around clinical decision support tools to guide clinician ordering. And that is translated, not only right test, but a reduction in cost and a lot of elimination of unnecessary testing.
Great, thank you so much. I just want to address a couple of the questions. The one that may be more focused on our discussion today is, if the focus of your career is lab operations or management, is it important to pursue a PhD, even if you don't have the goal of performing more research personally? And I think we can answer that here.
I can try answering that, and the answer is no. And I think James and Don have clearly shown that you don't need a PhD to be a successful operational leader. So if your focus is on operations, then you can focus on that. You don't need a PhD. I think Dr. Tui and I came to operations from a slightly different angle. We were also, I guess, interested in the technical and clinical aspects. So we decided to pursue the PhD program, did our fellowship, became lab directors, and got involved in operations that way. But you don't have to follow the path that Dr. Tui and I followed. I think Don and James have demonstrated that you can have an amazing career without a PhD in lab operations.
I concur with Dr. Pende. That I've seen and worked with amazing, lab operation leaders, and we are the subject matter experts and technical expertise, and we learn so much from our partners in the lab operation, and they are their subject matter experts in their lab operations, and we couldn't really survive, without them. So and they really have, amazing, careers and their skills and, expertise through their career ladder. So I do agree, you don't necessarily need a PhD. If it shouldn't also stop you from getting a PhD if you do so. So yeah.
I think if I could add to that, a few things that I might recommend for lab operators. I'm a scientist by background, right? Like everyone here, having some business acumen, really important. If you don't have it, academically, you do need to get some, but also some project management skills as well. Really important, not a strong suit of mine. Certainly when I have a good project manager, I'm very appreciative, but those are some skills that will really help you as an operational leader.
Yeah, great. Thank you so much. Yeah, I 100% agree on trying to gain either looking at opportunities to learn more about project management and business, because and I would say even health information I think is a great area as well. So we have a number of questions regarding just career paths. I'm not sure that we're going to get to all of them. I think just in general, recommendation, if you're looking at pursuing any sort of laboratory career, is to make connections. If you have questions, to reach out to, laboratorians, laboratory directors, laboratory managers in an area that you're interested in and directly, and trying to see what their path is and trying to make those connections, because it's challenging. Everybody's path is a little bit different. Of course, you need to have, depending on your where you're at, there are certain education and certification or licensing requirements that you need to try to achieve. So in general, I don't think I'll be able to answer or ask all of those questions, but those would be some suggestions. So thank you again. I think this concludes today's program. I really want to thank sincerely Don, Jim, Utsef, and Pui for joining us today for this lab operations webinar. A recording of today's event will be available within 1 week. So thank you all and have a wonderful day.